Let's see the best practices of the world. Sweden, the competitive public model. Sweden proves that a government system doesn't have to be slow. They use a purchaser provider split. This means the government pays for the care, but they force public and private hospitals to compete for that money. If a government clinic is too slow, you can choose a private one and the government check follows you. This creates a constant race to be the fastest and the most efficient. Thailand, the great equalizer. Thailand is the gold standard for developing nations. Their universal health coverage, which is a system ensuring every citizen has access to care, treats private and public hospitals as equals. It has virtually eliminated medical debt by giving every person the power to choose where they are treated regardless of their income. Canada. Canada uses Medicare. It's a simple single payer system. The government pays for everything, but private doctors run the clinics. To keep it fair, the government fixes the fees. A doctor cannot charge you extra for better service. Everyone gets the same high standard care. Germany. Germany uses the world's oldest system, social health insurance. It is powered by 200 non-profit organizations called sickness funds. Both workers and employers pay into them. You choose your fund, you choose your doctor, and by law, they cannot turn you away. Ireland, Switzerland, and the UK. Sometimes the best healthcare isn't a doctor. It's a law that changes how we live. Ireland was the global leader, becoming the first to implement a nationwide indoor smoking ban. Switzerland is fighting diabetes by considering a tax on foods with a high glycemic content. These are sugars and carbs that spike your blood sugar dangerously fast. The United Kingdom uses a traffic light labeling system. Red, yellow, and green stickers on food packaging make it impossible to ignore if what you are buying is unhealthy. Bhutan. Bhutan is providing that a small budget is no excuse for low quality. Their main hospital sought international accreditation, which is a formal seal of approval from an independent global body. They worked with India's National Accreditation Board for Hospitals and Healthcare Providers. They didn't just get a certificate, they put quality improvement training directly into their medical schools. Now, students lead their own projects to fix hospital errors before they ever happen. Indonesia, the center of excellence. Indonesia is fighting the culture of blame. Traditionally, doctors might hide mistakes to avoid lawsuits. The Center of Excellence for Patient Safety and Quality changed this. This center is an independent organization that uses TikTok and Instagram to teach families about their rights. By making safety transparent and social, they are turning hospital errors into learning opportunities for everyone. Vietnam, they mastered the golden hour. They created a code stroke team, a specialized rapid response unit that starts working the moment a patient arrives. They cut the door to imaging time, the time from when a patient enters the hospital to when they get a brain scan, to under 45 minutes. This speed prevents permanent brain damage and saves life. Maldives, the digital dashboard. Managing health across hundreds of remote islands is a nightmare without a technology. The Maldives Healthcare Quality Standards is a web-based digital platform. It tracks 625 different points, such as drug stocks and water quality, in real time. The Ministry of Health can see the performance of every island clinic on one single computer screen. Sri Lanka. Sri Lanka focuses on the human side of medicine. Their 1926 mental health helpline provides 24/7 free support to prevent suicide. They also allow birthing partners in the surgery room during C-sections to reduce a mother's anxiety. Singapore. Singapore uses a cross-institution infection control audit. This is brilliant. They have nurses from one hospital. Go and inspect another hospital. This peer pressure system keeps hand hygiene and cleanliness at a near perfect 98%.